listening to Teens and Ash, the show where two real-life providers get real about health habits, wellness, and the broken healthcare system. We're here to educate, empower, and entertain you. One appointment-free episode at a time. This is healthcare without the bullshit.
Okay, good morning, everybody. Teens and Ash coming to you live from the Ashley Clinic. Well, we are. But anyway, we wanted to talk about cold and flu season. Cough, cold, sinus congestion, cold, flu, virus season. Virus. So we get a call quite a bit, and even in an ER setting, quite a bit. I need an antibiotic. I'm sick. How many days have you been sick? 3. It's always 3. And that is just the beginning for your virus.
Just the beginning.
Virus
Just
is
now
last
getting there.
between 10 to 14 days across the board, sometimes longer, rarely shorter. And you will feel bad intermittently, at least for 10 to 14 days. So it's like a hill, like I got sick, something's wrong, choo. About day 7, we hit like a peak.
Oh, it's terrible.
And you're like, oh man, am I going to make it? And then we start getting better. Like every day you're going to start feeling better.
A smidge better.
But
The cough will linger.
the cough will linger.
Like up to 6 weeks.
Can last up to 4 to 6 weeks. And it is annoying. And there's really no cough suppressants out there that you need, one. However, we can't prove what your pneumonia base is. Is it bacterial? Is it pneumonia? Is it viral? Was it viral, then became bacterial because it's not in your-
Opportunistic.
So then you have to have an antibiotic. The time frame, unless you have like a complicated lung history, COPD,
Smoker.
pulmonary fibrosis, cystic fibrosis,
Asthma.
even with asthma, you
Mhm.
need 7 to 10 days.
Absolutely.
And then you need to pop a fever after
Yeah.
you've improved before you need antibiotics, truthfully.
Yeah.
Even with asthma and COPD.
But my other doctor gave me antibiotics when I was 3 days, and I got better within the next couple of days.
Course. Well, you would have gotten better with or without
Without.
antibiotics. It doesn't matter. I'm sure there is a percentage of the population that are to, decline horribly, and we're never going to be able to tell.
But they
that
tend to
those
be
people-
over.
But
the
they
comorbidities.
follow a pathway as well. So
Right.
it'd be comorbidities, diabetes, hypertension, emphysema,
Cardiovascular disease.
all the things, histories of recurrent pneumonias, which means you probably got some underlying, lung
Issue.
disorder. But those people, you are probably going to head right for the antibiotic
Right.
sooner than
Cascade.
later. So for
Algorithm.
cystic fibrosis and pulmonary fibrosis or bronchiectasis patients, those patients, you start antibiotic across the board
Because they're going to worsen.
they are not
Way
going to get
quicker.
it up. They're definitely going to get worse.
Yeah.
So those patients are a little different. But for the normal, healthy, I woke up, I feel bad, and I've been sick for 3 days.
Okay.
Three.
No fever. Sinus congestion.
even
Nasal
with a
drip.
fever.
A little bit of cough.
Even with a little
We're going
fever.
to talk about a fever in just a second.
Your body, why do you have, your body has a fever because it's doing what it needs
Fighting
to do.
infections.
Fighting
Oh, and another
infection.
thing. You can have green snot and green sputum.
Green and
can.
yellow sputum does not mean you need an antibiotic.
Absolutely not. It just means that your body is fighting a little bit harder to remedy what's ailing you.
Those are also reasons to not take an antibiotic.
Absolutely. Because what you're going to do with an antibiotic when you have a virus, what you're going to do?
Right.
You're going to cause a super infection. Realistically, antibiotics have a lot of side effects or a lot of, oh my God. No, risk when taking them.
Yeah.
Thank you.
They do have
It's
fibers.
called a risk. Yeah, you could have an allergic reaction. And, we don't want to do
Remember
that.
the colitis, C. diff.
Delicious.
You thought you had problems.
You
so
thought you had diarrhea once or twice.
Yeah, until we're talking to you about fecal implants.
Yes, shit slurries. Shit slurries. Have your family members bring in poop so that we can instill it into your
In a capsule. And then they
body.
can take it. It's amazing. Google that. Y'all should Google
That shit
fecal implants. Yeah. Antibiotics come with a lot of risks. And people just don't realize, they're like, I just need a Z-Pak. Oh, let's talk about the classes.
We have, a list.
Yeah, there's a list.
Which bacteria
Top
causes
to bottom,
what?
top to bottom, best to least effective that we follow. They're guidelines that we follow because a gagillion humans have gone through
11 million.
11 million
Humans.
one
yesterday, and they have gone through like rigorous studies of what works in this population for this illness. And then they print these guidelines. It's super crazy. And then we follow
And
them.
they share it with us.
And they share it. It's so weird.
And so we have to follow those guidelines. And the guidelines do change,
Truthfully, they're getting more stringent.
Yeah.
You
So
know.
we have to be really good stewards of antibiotics.
Yeah.
We can't just willy-nilly give you an antibiotic because you're on day 3 or 4 or 5, 6, 7 of your virus and you think you need one, because antibiotics are not going to work on a virus because they don't have a cell wall. Antibiotics hit a cell wall, they dissolve the cell wall, the bacteria floods the system, you all of a sudden feel worse since you started the antibiotics, and then it attacks whatever's left over floating around without a cell wall.
Or if the
Really quick.
antibiotics are not attacking viruses, what are they attacking?
Good stuff.
Good bacteria you need.
It takes about 2 years to completely recover your gut after taking an antibiotic one time. So you've killed all of the good flora in your gut. We have so many people with so many gut issues because they have terrible gut flora because they did an antibiotic when they had a virus.
And, even the otitis media guidelines are starting to change. Like,
They're very self-limiting.
they're wanting you like a time frame to go with it. Now, in the emergency room, it's a little harder to follow guidelines. Well, it's not hard to follow. That's not what I meant.
She's
It's very
following them guidelines.
easy to follow the guidelines. However, when you're in the emergency room setting and a pediatric patient that comes in with a otitis media, which is an ear infection, and a high fever, and they're just pitiful. And
Yes.
and then you worry about their follow-up and things like that. So that will lean more towards provider discretion, I think, at this point than in the past. It was just like,
Because not everybody fits in a box. It's true.
Mhm.
So you have to use your gestalt to decide what's going on. How are we going to treat this? You can't just, line says this, I'm not going to do this. But for the most part, the guidelines are
accurate.
absolutely accurate.
And God.
That's why we can have anything nice.
Every time. I follow guidelines and I bring it out and to the patient is a lot. So sinus, what do most adults come in and say? I got this sinus. Well, right. Well, if sinuses is, we do not treat with antibiotics until you've been sick for 10 days.
10 days.
10 days. You need to eat, or you have an acute presentation with high fever, sinus pain, pressure, generalized, there's usually something else.
feel like
You've
crap.
had sinus
Like you're
surgery. Yeah,
Yeah.
there's other things. Usually with those patients, they've had like chronic sinus issues with surgical intervention. There's always something else with that. Or another thing would be like bronchiectasis, pulmonary fibrosis. Those things typically go together. And so they have some underlying comorbidity that makes them a candidate sooner than later. It's really not, most of the time, not the presentation, right? Like in a normal adult. But sinusitis is 10 days or that you have been sick. And usually we like to see, I was bad for 7, 8 days. I got better. And then boom, I got worse. And then we're like, okay, we have reached tick, tick, tick guidelines. Like where we're like, you know what? This is probably appropriate now to start an antibiotic.
Yeah.
The antibiotic for sinusitis is not azithromycin. Not the first pick.
Unless you have a severe penicillin allergy, Clendis, try it, 4th generation cephalosporin.
But it's
Because it penetrates the sinus wall.
But what do most people
Z-Pak.
get a Z-Pak?
Let me get
Z-Pak.
it's a Friday. I need to go Z-Pak because this weekend I'm going out of town. I got to have something to help me get through it.
So Z-Paks seem very benign, but they come with a lot of, they're not risky antibiotics, I would say. Like there's a hierarchy.
And, people think, oh, I took my 5 days of my Z-Pak and I felt better on day 3.
And then I stopped it.
And then I stopped. Okay, great. Well, and another thing too is, a Z-Pak lasts in your system another 11 days after you complete the course of therapy. So, you go in, you've taken the Z-Pak, you don't feel any better. Well, 1, it could be a virus, but 2, maybe you haven't given it time also to work, but we're not giving it azithromycin rosinis. I'm just saying, I'm just letting y'all know that it works. You have 2 weeks of antibiotic therapy in your body after you take a Z-Pak. So
there are probably indications in certain scenarios of starting a Z-Pak for a sinusitis, but it would be very specific on history and bugs. Like what bug are we treating? But it is not the primary one because it doesn't penetrate well. So if you are like, I went to urgent care, got me a little something.
Yeah, but that's like,
you can give
like our COPD or some things like that.
Yeah. and azithromycin are
Nobody died.
actually they're moving. You know what's really moving up the chain is augmentin for a lot of
I
things.
love but I hate it for the gut. Oh my God.
It's a tough antibiotic.
Jeez, my knees.
But it is moving up the chain.
That's got good penetration.
Azithromycin for tonsillitis or strep that are penicillin allergies.
Oh,
But that's a different dose. It's not a Z-Pak. It's the 500s.
Once a day.
Mm-hmm. Okay. So that's a different, it's still azithromycin.
See, I'm still learning because the algorithms change, the guidelines change, so we're always having to stay up to date. So
anyway, so talking about fever.
Y'all, listen, if your baseline temperature is 97.1, you come to me with a 99.9 temperature, it's not a fever. Anything a 100.4 or greater is considered a fever. And realistically, it's your body's natural way of fighting off whatever it is you're fighting. So I'm going to let it ride, honestly. But if you come in and you say, I have 102.4 fever, I have 104 fever, but I wanted you to see it, believe you, treat it. You're going to feel like shit with 102, 104 fever. You're going to maybe even hallucinate and hear stuff.
Yeah.
At 104. Yeah, as an
You're
adult.
gonna feel real bad.
Kids don't do this.
No, kids are still running around.
They're resilient little
4
things. 104 fever, I'm going outside and playing in the water.
But then like 104.9, then they're like, they wilt.
Looking a little punky at that point. So treat your fever. If it gets high, if it's 100.4, you're going to feel like crap, but kind of let it ride. Let your body fight off whatever it is is ailing you.
And most adults, truthfully, so COVID
Tylenol or
Motrin, yeah. But COVID changed. I feel like COVID changed the landscape of adults and fevers because, influenza would do it every year for a short period of time where you'd get someone who got the flu really for whatever reason and they show up with 103 fever and you're like, oh, but they feel terrible,
they look terrible.
But when you've seen 14 other positive flus prior to them, you start realizing what you're looking for. But COVID kind of changed that landscape because other than flu, and adults usually don't present with high fevers.
No.
Until COVID happened. And then all of a sudden, all these adults started having high fevers. And that changed the landscape a little, but it did start us talking more about fevers and what the guidelines were for fever. So you don't want to treat them initially unless you're feeling, if you're feeling like I can't survive, I cannot live, then take something, obviously. And we don't need to know. We don't need to see you. We need to know. We don't need to see you with said fever. Like when you say, right before I came here, had 102.3 fever, took some Tylenol, and you get to us and it's 100 even, I'm going to literally write. Patient stated they had 102.3 fever prior to arrival, and they took Tylenol and fixed their lives.
I feel like also with COVID, it changed the landscape of people having certain things to their house, like a thermometer. But now we've gone retro. We went back to a pulse ox and a thermometer. But now we've gone retro. We don't have thermometers in the house anymore. And you come to the office and you said, have you had a fever? Well, I don't know. I felt like I had a fever.
I bought one at the Publix.
You can get one at the dollar store. Just grab one. Have it on hand. You don't have to, just keep it in a drawer somewhere. Know that you have one at your fever. Write down, at this time of day I had this fever. I treated it with this. And let us know what you've done for yourself for it. It helps us.
It really does. And your kids too.
Yeah.
It really helps when we have that information on your children. And so, like she said, if your normal body temperature is 97, still not a fever when you're 99.
It's not. 0.4.
That's what we're gonna go by. If you're a fish, it's really gonna be. I'm not up to date on my vet med fevers, so I'd have to look that one up.
But what is the temperature of a fish? I'm just kidding. We also worry about temperature also when you become septic, when you've been sick for so long, your temperature is going to drop lower than normal. So
yes,
it's really good to have a thermometer on hand. So if you come in tachycardic, your blood pressure's low and your temperature's low, you're being admitted.
You can also have a high temperature too in the initial.
Yeah, in the initial phase, absolutely.
So sepsis is a guideline changer.
They used to call it blood poisoning.
And so if you are a young person that has had sepsis, for whatever reason, like that, I feel in my history taking, that's a comorbidity that might change the way I'm looking at everything that you're presenting with.
What were you septic with?
Correct. Was it surgical and you had sepsis?
Was it an abscess gone awry?
Right. Like those
Was it a kidney stone? Oh God, those are bad.
Yeah, that's a
septic stone.
Mm-hmm. those are things like that change a lot of the delivery for an antibiotic, and a fever in a otherwise healthy adult, even because that's not something that most people will think of to tell initially.
Yeah. Oh, yeah, by the way,
Yeah.
I was intubated and hospitalized in ICU for 14 days with sepsis, and I was on
No,
like 17 different
they usually
pressors.
tell you that part. It's the other one where I was like, yeah, I had this abscess and I was in the hospital and they said I was septic, but everything went fine. They got better. Those are the ones that they forget to tell you. The intubation, they remember.
I forget completely. I'm like, Jesus, she got Alzheimer's or what's
True
happening
story.
here?
I mean, occasionally we're like, I didn't think that was relevant. If it is
Because
medical,
this is just a cold or this
yeah,
is whatever.
that doesn't have anything to do with it. So that's another thing. Like when you're talking to patients and you're like, had any surgeries? Nothing to do with what I'm here for today.
Oh my God, I need to know. Just tell me.
I know.
History is very relevant. All of it.
It is very relevant. It might not be to you, but it really is to us and to every other provider
Down the
behind
road.
us.
Because we share our records. When you say, hey, send my records over to here, there, or wherever, and we have an incomplete history, that other providers going, well, my God, they had 17 other comorbidities. How come this person
Did they
doesn't know?
even
They didn't tell us. Were they in the office?
Yeah. I mean, it does get, I mean, in an ER setting gets, so it initially, like if I go in and I'm like, all right, any medical history, anything, and they're like, no. Then you go back, right? And you're like, why is this patient on a blood thinner?
That's a pretty.
Hold on a second. Let me go back. And then you're like, hey, I saw you were on a blood thinner. Okay.
That's also going to change.
Okay. Anything else? Like anything like why did you have pulmonary?
I only have one lung.
Oh yeah. And they
Forgot.
went, pulmonary infarct, complete.
Yeah. Circling back. So I need to know how long you've been sick, what symptoms you're having. Did you have a fever? What have you done for your fever? Any comorbidities? What kind of history do you have? And then I want to know what you did for yourself, because here's a few things that you can do for yourself on your own. You can take an over-the-counter cough medicine. You could put a cool mist humidifier in your room at night to help break up secretions, to make them more mobile, to get them. You can increase your fluid intake. That's a huge one. People are, it'll help your postnasal drip. It'll help you just not have to cough so much if you just sip on fluids throughout the day. Tylenol, Motrin for fever.
Sudafed if you don't have high blood pressure.
Vicks Vapor Rub.
Do some
oh Lord Jesus, get the kind with the lavender on it before you go to bed at night. Stick it on your nose, stick it on your chest.
Girl,
Put it on the bottom of your feet, put some socks on. I'm good.
I do like some Vicks Vapor Rub.
Love it. I would wear it just when I just don't even like today. I would wear it today.
Smell like an old lady.
I smell like I'm 50.
Venice.
I love some Vicks Vapor Rub. The dollar store has the one with the lavender. It's really nice.
The Afrin. Let's talk about Afrin.
Oh Jesus. Sorry, my eyes watering.
You are as an adult, you're pretty ill. You feel terrible. You're not really having a fever. So you're not like, I need to go to the emergency room ill. However, you can, every time you lay your head on that bed, one side of your nose is like,
And then you flip over the other side and
and you're like, it's like midnight and you're up in 4 hours and you're like, okay, I got to fix my life. I am a huge proponent for the appropriate use of Afrin. I know that is going to be so debated. And
short term.
If it keeps you from using an antibiotic, short term, I'm down. 5 days is short term. You do not use it more than 5 days.
Short term.
You will get rebound congestion.
Oh, Jesus.
Prepare your soul.
Your sinuses and your nose is going to... It's going to swell back right. It's just going to swell
It's
up.
best if you could just limit it to once at night, once in the morning. And then
take your over-the-counter stuff in conjunction
other
with
things. Other things too. This is last resort when you have literally like, I cannot live like this.
Or you want to cut your nose off your face?
Yeah.
That one. That's when you use it.
When you're like, you go to the emergency room. Hold on. Let me try some Afrin. Right, that's my PSA.
I like it.
I mean, I've even prescribed it to young, healthy people, like as a prescription, because that's what they came for. They literally don't know what to do. And I get it. No.
When did that stop? Let's talk about that. When did that stop? When did our parents stop teaching us how to take care of ourselves?
I think it's the generation. It's our generation. The Gen X.
I taught my kids.
Not all of us. Remember, most of us were left to our own devices growing up, right? So not all of us were given, I'm just like, right?
Okay.
So a huge I think that's where the fallout is. And because our parents had very hands-on grandparents. We didn't have as much hands-on grandparents, and then it seems to have worsened as the decades have gone on. So
Okay.
I think the truth of the matter, and I noticed this
We
early
did
on
this.
when I was in nursing, I'd say nursing like in the early 2000s, like the patients would come in and you would say, like before that, they would say, well, my grandmama told me to da 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 da. And then all of a sudden I'm like, what'd you do for yourself? Nothing. I'm like, no one, but they either didn't have grandparents, they didn't have parents.
Yeah.
There was a whole
Parents were busy
bunch
working.
of-
Like I was a latchkey kid. My parents were working.
yeah, same.
Take care of myself.
Yeah.
Yeah.
And my mom though was a nurse. So
But
she gave me,
my mama was not a nurse.
she
But-
told me things to do.
You'd be thrown up and having diarrhea, so you would just sit up all night on the toilet with a bucket in your hand, and you would not go to the ER for that ever because it would pass. It's a 24-hour bug.
Ginger ale and
cough,
salty.
cough and Price
Barker.
is Right. Oh my God, yes, Bob Barker came on at 10 o'clock in the morning on Channel 5. I'll never forget as long as I live.
There was
I
nothing
love the show
better.
Showdown. Oh.
There was nothing better than being sick and watching The Price is Right.
I used to pretend sick in the fall so I could watch the Halloween show. Oh, Mama, it fell. I got to stay home today. And I'd watch, like, I don't know, Ichabod Crane and
Yeah.
that stupid Disney.
Mm-hmm.
Sit there on the couch.
Well, there was
with my
none of that.
toast and my saltines.
I'd have
and
to
my
watch
ginger ale, Flat Sprite.
Flat Sprite.
Flat Sprite.
I had to watch what are those called? Soap operas with my
Oh,
grandma.
I love Days of Our Lives.
I did not enjoy them, but I was in it.
Jesus. I love it.
I was in it. We were General Hospital people.
I like General
Bold
Hospital
and
when I
the
was
Beautiful.
late. I never watched the Bold and the Young and the Restless.
Oh, she didn't watch that one.
Boy, we watched Days of Our Lives with Bo and Hope Brady. Yeah.
That's hilarious. I forgot about all that. That's how you were sick in the 80s.
Yeah. Price is Right, followed by
I actually, as a child, I had never been to the emergency room.
I went I used to get pneumonia a lot as a kid. I think I had bad lungs.
I had bilateral pneumonia and was admitted for 10 days, but still
Man.
didn't go to the emergency room. My mom still didn't take me to the emergency room. By the
She
way,
wasn't doing it.
she is no longer here with us, so I can talk about all this. Otherwise, she would call me out immediately.
Tara! So, yeah. So what you can do for yourself with this yummy viral season, and we're seeing it. We're absolutely seeing. We're even seeing like a little bit of COVID here and there. I don't care. It's a virus. We're not going to treat it, and our
Actually,
treatment is not going to change.
Not seeing a ton of COVID or flu.
I've just seen like a couple.
It's just virus.
It's
An
just virus.
unnamed-
It does not pop positive for COVID or flu
Right.
on our swabs. It just is a virus. Is a virus. Is a virus.
Mhm.
Just is what it is. We still have colds in America. We still have
We do.
viruses.
We do.
We still have nausea. We still have vomiting. We still have diarrhea. Self-limiting. They're not going to last very long. I mean, unless you've, I don't know what.
Yeah. You got comorbidities, and then you're going to either get worse or you're going to get better. But see, those people know to go be seen.
And those people know.
All right. Well, that's that on that.
Yeah.
And that's all I have to say about that.
Take care of yourselves, y'all.
You're listening to Teats and Ash, the show where two real-life providers get real about health habits, wellness, and the broken healthcare system. We're here to educate, empower, and entertain you. One appointment-free episode at a time. This is healthcare without the bullshit.